Coronal synostosis is the fusion of either the left or right coronal sutures in the head. Coronal synostosis is also known as anterior plagiocephaly. The term anterior refers to the front of the skull, and plagiocephaly refers to a flattening of the head where the coronal plates are fused, which from a bird's eye view will look like a diagonal line, with the lower part of the diagonal at the fused side of the head and the elevated part of the diagonal at the non-fused side of the head. From the top of the head, this can just look like the unfused side is protruding. From the front, there are two markers of coronal synostosis. First, the eyebrow region of the face will be higher on the fused side of the head than the unfused side. And second, the nose will appear to lean towards the affected side. This is because the root of the nose is being pulled toward the fused side of the face. For example, if the right coronal suture is fused, from a bird's eye view, the right side of the face will appear to be more sunken in and flattened than the left side of the face. From the front, the right eyebrow region will be higher than the left, and the nose will appear to be leaning toward the right side of the face. This relationship between the suture that is fused and the effects on the facial suture is described by Virchow's law. In 1851, German doctor Rudolf Virchow described how the skull compensates for the lack of growth perpendicular to the fused suture by adding extra growth in areas parallel to the fused suture. Think of this just like the type of compensation that has to happen when you're working on a team project at work and you have to do extra work because someone just got stuck in a snowstorm and couldn't be there. The main reason that coronal anomalies are a problem is because of the important and profound amount of growth that occurs in an infant and young child. For instance, the space inside the head, known as the intracranial volume, triples in a normal child within the first year, and after 2 years of growth, the capacity of the head is 4 times as large. Growth of the brain can be restricted by the closed sutures that restrict skull growth. This restricted skull growth can lead to an increase in pressure inside the head. High pressure inside the head is something that can result in impressions on the inner side of the skull, known as the inner table. Also, if left untreated, the increased pressure inside the head can lead to papilledema, which is swelling in the optic disc of the eye, where the important optic nerve is located. This swelling in the eye can even lead to the optic nerve becoming damaged, leading to sight problems. The surgery to correct coronal synostosis can be endoscopic, which uses a small tube to go into the head and release the fused sutures. Also, a traditional open surgery can be performed where a headband-like incision is made and the fused suture is released. Research is being done on what causes craniosynostosis. An interesting and highly accepted genetic relationship has been found between mutations in the TWIST1 gene and the FGFR3 gene. Mutations in these two genes have been associated specifically with coronal synostosis. What this means is that there appears to be a relationship between the mutation and condition of craniosynostosis. However, each individual is different. The outward physical expression of these mutations has been shown to vary a lot. It appears that the mutations occur in a spectrum pattern within the TWIST1 and FGFR3 genes, which means that there isn't a clear on and off switch as much as a range from dim to bright. The research suggests that it is useful to include a screening for mutations in the TWIST1 and FGFR3 genes during genetic counseling in cases of coronal synostosis. Genetic counseling will provide an insight into where the individual lands on the spectrum of mutations, and the geneticist will then be able to provide them with information about what that means for them. Information for this video was gained from the peer-reviewed research article below in the information box.